drug inside it. As soon as you consider the strength, 500, 650, it is called a formulation. Those who are feeling sleepy, please drink water. I will give you 2-minute break. It's very natural to feel sleepy now, nothing wrong in it. Just drink a sip of water and you will become energized. Everyone, drink it. There's no point in sleeping. If you have come, try and take something from the class. Basically, human brain cannot take anything for more than 8 minutes continuously. So, listening continuously to something for half an hour, 1 hour, it is natural that you will sleep. There's nothing wrong with it. So, take break. So, we have discussed what is a drug, we have discussed dose, we have discussed dosage form, we have discussed formulation. Something here it is written excipients. Excipients here. What are excipients? Shomik to namoli. Shomik. So Shomik had that mutton curry. Shomik's mutton curry, apart from that mutton, had many other things. Mutton is the main thing that he ate, but he cannot enjoy the mutton if it is raw. So we have to add a lot of things in it. Those things are the excipients. So basically, in a tablet, in a syrup, in any dosage form, there is the main drug which is called the active pharmacological ingredient. And with that active pharmacological ingredient, lot of things are added. As for example, a drug is very bitter. You add something that makes it very sweet. That is an excipient. A drug is very unstable. As soon as you keep it in open air, it will be destroyed. It will lose its functions. So you add a stabilizer to it, some protective covering. A drug is such that as soon as you take it by the oral route, by mouth, and it reaches stomach, acid will be destroyed immediately. So you provide a coating so that it can be protected from the acid. These are the excipients that you are adding to the main substance, the main drug, so that they can be, so that ultimately the drug can act in our body. Now, what are the different types of dosage forms? These are certain things written, you can go through it, but PPT will be provided to you, various types of excipients and all. Let us skip. Anyway, you are feeling sleepy, so, and you have full right to feel sleepy. Very boring topic. What is the function and advantage of dosage form? I will not read through the slide. But I hope you have understood the basic thing. Why we need a dosage form? Because you cannot directly take the chemical because of various reasons. PPT will be provided, you will not take the picture. As far as I know, we have discussed this PPT will be provided to you. And in all the classes, at least for this topic, the same PPT will be taught. So see, makes the API means the main drug, the active pharmacological ingredient, makes the API suitable for administration in various ways. Means when you prepare a dosage form, when you prepare a tablet, a capsule, a syrup, basically the chemical that is inside it, that is you are preparing something so that that chemical can be used in the body of the patient. That is the main thing. Otherwise, if it is very bitter, patient cannot take it. So you are preparing a capsule so that the bitter taste is not there, or a sweet coating you are giving so that the bitter taste is not there. Okay. And to protect from atmospheric conditions, I told you it may be destroyed if the proper form is not prepared. To protect from endogenous factors like gastric acid, to extend duration of action, you can go through these things. But the basic concept I hope you understand that the chemical that is produced in factory you cannot directly give to the patient. A lot of things have to be done so that it becomes or it reaches a state in which it cannot be given to the patient. Otherwise, it will not act. Either the patient will not take it or it will not reach the desired site, it will get destroyed. A curry has to be prepared, a mutton curry has to be prepared, that is edible. Okay, that is the dosage form. And you can go through these points. Now, what are the different types of dosage forms? Solid, semi-solid, liquid, gas. What other types can be there? There are these things in the world: solid, semi-solid, liquid, gas. So all these dosage forms are there. Something is solid, is a solid dosage form. Semi-solid, semi-solid. Something is a liquid dosage form. Like that. We will go through the examples. That is important. What is the solid dosage form? The first example of a solid dosage form is powder. All of you, I hope, know ORS. ORS is a solid dosage form. ORS. জল খা তো নাম কি? হ্যাঁ? শ্রমিক। তুই জল খা তো তুমি করছিস। It's okay. You are full right in my class to see. So the dosage form is powder. Okay? So what I told you, ORS. ORS is the best example. All of you know ORS. Powders. If you go through the important disadvantage of powder, you know, if you even see the ORS, it's a very large amount of the drug that is to be administered. So generally, when we are using powders, we are using very large amount of the drug. Okay? So that is a disadvantage of using powder. But the advantage is that suppose you have to apply a drug on skin, on a large area of the body, you have to apply drug. Then, if it is powder, a large amount of drug is available to you, it is an advantage. Okay? So when you have to administer large quantity, powders is advantageous. But the disadvantage is that you have to prepare big packets. It is difficult to carry. And there is effervescent powder. What is an effervescent powder? There is an acid and there is sodium bicarbonate in the powder. So as soon as you add water, bubbling occurs. Bubbling. CO2 is produced. The best example is all of you have heard ENO. ENO is an example of an effervescent powder. As soon as you add water, bubbling occurs. Okay? So see, ORS, powder, ENO there is. Now there is another candid powder. You will come to know about this thing. This is an antifungal drug, very commonly used. Maybe some of you have already used it. And, what? You know candid powder. Okay, very good. So these are examples of oral dosage forms. This you have to just remember so that when you are shown, you can say that this is a powder, nothing else. Okay? Another thing about powder, just remember that if a powder has only one component, it's called a simple powder. Like candid powder, it contains only one component, chlorothiazole. And if it contains more than one component, it is called a compound powder. ORS has many components. So this thing you can remember if you want. Next, very common, most common dosage form, tablet. All of you have taken tablets. This is a tablet, an antibiotic tablet. This is another tablet. So you all know how tablets look like. They are solid forms. Solid forms of drugs. They are packed into spherical or round shaped structures. You know that. What you have to know is that there are different types of packaging. Different types of packaging done for tablets. You see here. This is one type of packaging. This is just aluminium. There is just aluminium in the package. A tablet is inserted inside in between two aluminium foils. Okay, this is a strip package. And there is another called blister package, where there is one aluminium foil and above that there is a plastic like this. These are all plastic blisters. And inside those plastic blisters, the tablets are inserted. Okay? These are few things you remember. Here you can see this is thyroid medic. This is used for hypothyroidism. You have studied hypothyroidism in physiology. This is used for hypothyroidism. Okay? This is in a container. Some special type of tablets. You can go through them. Just one or two examples, interesting examples, important examples, chewable tablets. Have you ever taken albendazole for worm? খেয়েছিস? তুই খেয়েছিস? কিসের কবে ছোটবেলায়? না ইদানিং কালেও খেয়েছিস? ছোটবেলায় চিবিয়ে খেয়েছিলি? তো these albendazole tablets, these are used for worms, small pig worms. They are also used for other ailments, worms. So you have to chew them. They are chewable tablets. Okay. Then dispersible tablets. Disprin. You have heard of disprin? Disprin. Have you heard? আগে টিভিতে অ্যাড দিত জলের if you just drop that tablet in a cup of water, it will get dissolved and you can take that. It will act very fast. Chewable tablet, dispersible tablet, and sublingual tablet. You have seen in old Hindi movies. Sometimes sorbitrate. Sometimes there is a quarrel and an old person, the big brother of the hero, suddenly develops chest pain. This type of scenes you must have seen. And then they will pick out one tablet and put it below the tongue. So these are the sublingual tablets. What happens? As soon as you put the tablet below the tongue, it gets dissolved. And in the sublingual space, there is a lot of blood supply. So the dissolved tablet directly goes to blood. Sublingual tablet, as we said, sorbitrate. It is used in ischemic heart disease, chronic coronary syndrome. So you will study them later on. These are then there are enteric-coated tablets. I have already told you that acid will destroy some medicine, so you can coat them so that they are not destroyed in the stomach. They are called the enteric-coated tablets. Okay. Then something there is sustained release control tablets. They act slowly. If you take them once in the day, they will act throughout the day. Some examples of tablets like albendazole tablet I told you. Then there is this vitamin C tablet. This is a chewable tablet, vitamin C. And he told sorbitrate. This is same group. This belongs to same group. This is called nitroglycerin. Sorbitrate is isosorbide dinitrate, and this is nitroglycerin. The same. They belong to the same group. They act in the same way. They basically cause dilation of the blood vessels in the heart when there is an ischemic attack. And this is a chewable vitamin C tablet. During COVID times, a lot of people were taking this vitamin C. Okay, this is a chewable tablet. So these are few examples. There is another solid dosage form which looks like tablet, but it is pill. It is called pill, which is basically a sticky thing that is rolled into a mass and has a covering. It is called pill. Best example are oral contraceptive pills, OCP. Next, capsules. All of you must have seen capsules. These are called capsules. There is a spherical gelatin cover. This is a gelatin. This capsule, the outer cover is made of a substance called gelatin. Inside it, we have inside it there are the drug particles. Okay, so these are capsules. Capsules again can be enteric-coated capsules. So the capsules are coated in such a way that they don't get destroyed by the stomach acid. Okay. What is the advantage of capsule compared to a tablet? Capsules basically you don't get the taste because of the gelatin cover. There is no taste most often. So whenever there is an unpleasant taste, it can be masked. But cost of capsule is high. Compared to that, if you see tablet cost is lower. Tablet cost is lower, and you can also produce large amounts of tablet at a time. Capsules, it is difficult to produce in such large amounts, and storage is also very convenient for tablets compared to capsule. Lozenges. You have seen, you have heard, you may have taken strepsils. strepsils, they are lozenges. They are those solid form of the drug which have to be kept in the mouth and slowly allowed to be dissolved. As the slowly dissolve, the drug will go and act locally. Like you have sore throat, you take strepsils, slowly it will dissolve and it will relieve the sore throat. Suppositories. This, I don't know how many of you know actually. Suppositories are to be given by the rectal route. This is a suppository. They are conical shaped structures. Conical shaped structures, you must at least remember that suppositories are structures that are given by the rectal route. And when they are introduced in the rectum, they, because of the high temperature in rectum, gets easily dissolved. And they also act very fast because in the rectum there is a lot of blood supply. Take a break for 2 minutes. So it's really torture. I mean, this topic is very boring, but you will be asked in the practical, maybe you will be shown one script and you will be asked like, what is it? At least you should be able to say this is a capsule. They may ask you what is an anti-coated capsule. These basic questions you should be able to answer. So you will be able to identify suppositories, all of you. Where are the suppositories given? Anal canal. Like suppositories, there is another solid form of drug called pessaries, which are given in the vagina for some intravaginal infection or something like that. Their picture is not here. See different types of suppositories, the shapes, but most commonly they are conical. These are suppositories, and this is an intravaginal pessary. They are given in the vagina. What is the advantage of a solid dosage form? Most important advantage is convenient. As soon as I tell any one of you, suppose you have fallen ill someday and have gone to OPD and there is anyone who is there, I may be there, and if I tell you that you have to take an injection, immediately you will start crying. Most of you, not all. No, I will not take. That is a common thing. Because injection is, you have to clear stage. Compared to that, if there is a tablet, just you will take it with water. So it is very convenient. It is convenient, very easy to administer. The doctor can just write it in the prescription. Patient will go and take it from the shop and drink it with a sip of water. Right? Ease of administration. Activation and reproducibility of dosing. That is that, suppose this is a liquid dosage form, we come to it. I tell you, you have to take 10 ml. Taking exactly 10 ml is difficult. You have to see, properly measure. Sometimes it will fall here and there, but when you are taking a tablet or a capsule, which is a solid dosage form, they are already preformed. There is no way something will spill over. You will have to directly take it. So exact amount of the drug can be given. But disadvantage is that when you take the solid drug, it will go inside the stomach, then it will reach the duodenum, it will gradually dissolve. Okay? So it takes time to act. Solid dosage form will take time to act. Compared to that, liquids act faster and injections act even more faster. Solid will take time because it will go inside the GI tract, it will gradually break up, the drug will come out, then the drug will be absorbed, then it will spread in the whole body, it takes time. Now liquid dosage form, there are various types of liquid dosage form. Just go through the points. Aqueous solution. Aqueous solution means there is a drug and the drug is dissolved in water. And have you seen betadine solution? Betadine solution is an antiseptic dressing solution. It has only water and a drug dissolved in water. Then suspensions and emulsions, those antacids that I was saying in the beginning of the class, gelusil and diazine and all, those antacids are all suspensions and emulsions. That means aqueous solution, as the name suggests, it's a water soluble drug. Suspensions and emulsions are not water soluble. A water insoluble substance is either suspended with the help of an agent, a water insoluble drug is suspended in water with the help of an agent, or two water insoluble substances are mixed. These are examples of suspensions and emulsions. What is important, please remember, when you are using an aqueous solution, suppose betadine, you need not shake it because the drug is uniformly dissolved in water. যে ওষুধটা আছে ওটা জলের মধ্যে uniformly dissolved হয়ে আছে, আলাদা করে নাড়ার দরকার নেই। But when you are using an emulsion or suspension, liquid antacid খাচ্ছিস, ঠিক আছে? It is very important to shake it before you use, because the drug particles will fall down. The drug particles will fall down. So if you shake it, it will get mixed. Otherwise, the drug will be mixed. It will be at the bottom of the bottle. So in suspensions and emulsions, you must shake. Elixirs, what are elixirs? Elixirs are aqueous solutions. মানে ওষুধ যে ড্রাগটা আছে, it is dissolved in water. In aqueous solution, water soluble drug. But in elixirs, it is water soluble, but there is alcohol and fruit extract. Aqueous solution, তার সঙ্গে alcohol আর fruit extract যদি চলে আসে, it becomes an elixir. Then syrups do not contain alcohol. Syrups are similar to elixirs. They have fruit flavors like that. They have a water soluble drug in them, but they do not contain alcohol. And linctuses are not very commonly used nowadays. They are very thick substances that have to be leaked. They have to be slowly leaked. This is betadine. This is an aqueous solution. This is an antacid. This is an antacid which is an emulsion or suspension. And this is an elixir. Just remember, elixirs contain alcohol. Aqueous solutions do not contain alcohol. Elixirs contain alcohol. And suspensions and emulsions, they are insoluble substances in water. Drops are another liquid form. Drops. Pulse polio, all of you know, polio drops are given. That's an example. If you have some eye infection, we give eye drops. For conjunctivitis, that is another example. You have some ear infection, ear drops. If your nose gets blocked because of a common cold viral infection, you use ointment drop. We use. It opens up the nose. So these are the examples of drops. Lotions are liquid preparations that are applied on the skin. Liquid preparations applied on the skin. Solution, emulsion, whatever, but most importantly, lotions are applied on skin. Calamine lotion, they are applied on skin. Now, injections are also liquid dosage form. Injections are given either intravenously inside the vein, or inside the muscle, or in the subcutaneous tissue, or in the skin. Intravenous route, intramuscular route, subcutaneous route, and intradermal route. Inside the skin, intradermal. This is, and how do you give injections? You give injections by syringe. The basic thing. This is a syringe. Okay? You give injections by syringe. And syringe has two main parts. One is the needle. One is the needle. Another is the proper syringe proper. The needle again has various parts. I think in following classes this will be taken up. But just to show you, there is a needle, and there is a syringe proper. The syringe proper again consists of this thing that is pushed to give an injection. This thing that is pushed to give an injection, it is called the plunger. This one. It is called the plunger because this can be asked in practical exam. Different parts of a syringe. This is a plunger. This is the barrel. Apart from the needle, the main part of the syringe where there are the various things that are written, that is called the barrel. Plunger and barrel, and then you have the needle. The needle has a needle cover. Needle has a needle cover. Alright, and just to tell you that this is basically an insulin syringe. By this syringe, insulin is given by the subcutaneous route. And in what forms do injections come? I told you that injections are given by various routes with the help of a syringe, but in what forms are they available in the market, in the shop? First, ampule. This you have to identify. This is an ampule made of glass. This is a glass, and it usually contains a single dose inside one ampule. This is an ampule. An ampule. Okay? Then there is something called vial. We don't have it in the tray at this moment. A vial looks like this. You must have seen it somewhere, some of you at least. And often a vial contains more than one dose. On the cap of the vial there is a rubber, and through that rubber injection can be pierced, and substances can be, the drug can be taken out. But for the ampule has to be broken. It has to be broken. Different parts of syringe, what I told you, and this picture shows different points of an ampule. This is the body, conical tip. Okay, these things you can go through. They can be asked. Liquid dosage form advantage compared to solid, faster onset of action. Solid has to be broken down and then absorbed in the body, but liquid can be directly absorbed. But disadvantage is the taste. Often liquid has a taste. Solid particularly capsules, the taste can be masked. So that problem is there. Liquid has the taste. Liquid is not very stable. If you don't, you can easily store a tablet anywhere in your home. Even if it gets exposed to sunlight, it will not be very easily destroyed. But a liquid, if it is stored in a very hot environment, it will be destroyed. So it is less stable. Semisolid dosage forms. There are 4 types basically. Remember the 4 broad types: ointments, creams, gels and pastes. Ointments, creams, gels and pastes. Ointment or cream, you remember first 2, ointment and cream. And you remember the last 2, gels and pastes. What is the difference between them? Ointments and cream contain lot of oil. Gels and pastes do not contain lot of oil. So ointments and creams are greasy. Gels and pastes are not greasy. When you are given to identify, in the packet itself it will be written whether it's an ointment or a gel. So you must be able to read it. Here is an example of an ointment. Ointment, please remember, it is most greasy. And it is often used in eye, nose, in areas which are inside or not the skin exactly always, but in the mucous membrane. Eyes, nose, their ointments are used. But creams are less oily than ointments So they are more commonly used on the skin. So just you should be able to identify and give one example. Gels, actually they are jelly-like, the name tells you, and why they are jelly-like? Because of gelatin. The gels, there is as I told you at the very beginning, apart from the main drug, a lot of extra things are added, excipients. So this gels contain gelatin, that is why it becomes jelly-like. And pastes, finally pastes. Just see the examples. You have heard about the Volini gel applied to get pain relief. So it's similar to that. Voltaren gel, this is an example of a gel. This is an ointment, an antibiotic ointment, new medicine. This is a cream, and this is a paste. Just remember that at least if someone asks you what are the different semisolid types, you should be able to say the 4 different semisolid types and give one example. Then the inhalational or the gaseous form of dosage. You know, patients when they have respiratory distress, they are given oxygen. So oxygen is a medicine and it is given in a gaseous form, right? So oxygen, it is a gaseous dosage form. When you are giving oxygen gas to a patient, it's a medicine, it's a gaseous dosage form. Then, you know, in anesthesia, we use many volatile liquids. For the purpose of anesthesia, we use many volatile liquids. Those liquids, when they are used, they become gases. Halogen is an example. They are used in anesthesia. So they are all gaseous forms of drug dosage. Okay? Gaseous forms of dosage. Halogen and I have told you oxygen. Halogen is used in anesthesia, oxygen all of you know is when it is given. But this part, aerosols, they are very important. On a regular basis, you will not see anesthetic agents being used. Only those of you who will be becoming anesthetics, they will be able to handle them. And surgeons, after some exposure in the OT, will know that. But as a medical student, in the initial years, you will not see those anesthetic agents. But the aerosols, you will deal with them. Basically, when you have respiratory distress, you know people with bronchial asthma, they take inhalers. Salbutamol is an example. Those inhalers and all, they come under aerosols. They are gaseous form of drug. There is no doubt they are all gaseous form. Okay? They come under aerosol. That means the drug in an aerosol form is being delivered to the patient. And they are delivered by various devices. One device is called the rotahelor. See, this is a capsule. This is called the rota cap. And this is the device by which it is given. It is called the rotahelor. So basically, this capsule contains the drug. With the help of this device, the drug that is present inside the capsule will be converted into an aerosol and will be taken by the patient. How it is used, we can skip it in today's class. After you have done your respiratory system, maybe you can take it up. But basically, there is a technique by which this capsule, with the help of this medicine, is broken. This capsule, with the help of this medicine, is broken. With the help of this device, is broken, and by a particular technique, when the patient inhales, an aerosol is formed. Next is inhaler. All of us see inhaler, right? Inhaler, unfortunately, it is not in the tray now. So, inhaler, there is a picture here. The inhaler has 2 to 3 important parts. The medicine is present in a steel, with a metal container that is called the canister. And this is a plastic body that is called the actuator. And then there is a mouthpiece and that is covered by a cap. And there again there is a medicine is inside the canister, and there is a particular technique, and you have to learn the technique later on. And by that technique, the medicine inside this inhaler is converted into an aerosol, and that aerosol will enter the body of the patient. Okay? And the last and very important type, you will deal with it in your internship days, in your if you do housekeeping in the housekeeping days, nebulizer. Nebulizer, it is another form by which again an aerosol form of the medicine is given to the patient, and all of them are being given by the respiratory route. Nebulizer, this is the nebulizer mask. The machine is not here. This is the nebulizer mask, and in nebulizer mask there is a chamber. There is a space in the nebulizer mask where we give a liquid, and there is a machine through which air pressure is applied, and under that air pressure, nebulizer picture they have not given here. Under that air pressure, that liquid is again converted into aerosol. Okay? So these are the things, and just see, this is a respule. This is called respule. The medicine inside it is actually added in the nebulizer. Here is a chamber, out space I am showing you. In this open space, in this space, actually this liquid is to be added. And what you will add, how much you will add, that is determined according to patient's condition. But you will add some liquid, close it. Then there is a tube. You attach the tube here, and the tube is linked to a machine, and the machine gives air pressure. Air under pressure, and due to that pressure, the liquid is converted into aerosol, and at a high speed, it will come out from the mask and reach the respiratory tract of the patient. This is an IV set for giving intravenous infusions. Again, it will be taken up later on in details. But there are two sets, all of you have to remember. One is an IV set and one is a blood transfusion set. Blood transfusion set means if someone is to be given blood or any blood product, that has to be given by a blood transfusion set. This is the blood transfusion set. How you identify, I am telling you. In the blood transfusion set, there is a filter here. You see a filter and network-like substance, a mesh-like substance. Can you see? All of you at the back, can you see? Technology. This is a blood transfusion set. In the blood transfusion set, there is a filter. Filter. এই যে একটা জালের মধ্যে দেখতে পাচ্ছিস? হ্যাঁ? This is the filter. When you see this filter, you should immediately identify it to be a blood transfusion set. In the blood transfusion set, these filters are present. Okay? এটা দেখে রাখ। এই নেট মতো একটা সাবস্টেন্স দেখছিস? নেট মতো। When you are given an IV set, তোরা সবাই দেখেছিস? নেটটা দেখছিস? When you are given an IV set, that net is not there. So you immediately can identify that this is an IV set, that is intravenous infusion set. That there is no net. Basic ekdom. These are very basic things. So you should be able to tell them during the exam. No net, no filter. So this is how you directly identify whether it's a blood transfusion or an IV infusion set. That's all for today. Okay? If you want, you can come and see these things closely. And if you have any questions, you can ask.
Attendance,
Yeah, who will take the attendance? There is CR in this room. Huh? Who will take the attendance?